Good morning, students. Today I will discuss the surface anatomy of upper limb, particularly which are important from the examination point of view. Let us start one by one. First of all, I will mark the head of the radius. You know, this is the radius and this is the head of the radius. I will mark this head. To mark this, the elbow, it is extended and forearm is pronated. And this is lateral side. The radius is the lateral bone of the forearm. So here I will get, this is the olecranon process of ulna, and lateral to this there is a depression, and lateral to this depression there is lateral epicondyle of the humerus. Below that epicondyle here there is another depression. So in the upper part of this depression, in the back of the extended and pronated forearm, I will mark this one as a head of the radius. So I am marking on the back, on the posterior surface of the head of the radius here. The radius, this is the bone, it is having the head and it is cup shaped, and this is one margin, and this margin of the head of the radius, it articulates with the ulna. The question may be, what are the joints formed by the head of the radius? Mainly two joints are formed by the head. One with the humerus forming radiohumeral joint, which is a part of the elbow joint, and another joint with the ulna. This is the ulna and this is the radius. So here this joint here, it is called the superior radioulnar joint. Both the joints, radiohumeral joint and superior radioulnar joint, both are synovial joint, but elbow joint is the hinge joint and the superior radioulnar joint is a pivot type of synovial joint. Head of the radius, it appears after birth at the age of 5 years from the secondary center of ossification, and it joins with the shaft of the radius at the age of about 18 years. Next point is head of the ulna. You know, this is radius. In this bone, head is at the upper end, but in the ulna, the head is at the lower end. I will mark this head. So here, to mark this head of the ulna, first of all I will flex the wrist joint and forearm is pronated. And on the medial border, here the lower end, this is the bony prominence here. That prominent part is the head of the ulna. I will mark here as head of the ulna. This head, it articulates with the radius at the lower end also, forming inferior radial joint. But one important question may be asked, it forms the wrist joint? The answer is no. The head of the ulna does not form the wrist joint because it is separated from the lunate bone. There is a cartilage intervening between them. That cartilage is called the articular disc, which is a fibrocartilage. And the head of the ulna, it also appears after birth from secondary center of ossification at the age of 5 years, and it, like that of radius, it joins with the shaft at the age of about 18 years. Next point is styloid process of radius. And this is radius and this is the styloid process. To palpate this, I will flex the wrist here and I will follow the lateral border of the forearm in a pronated and flexed wrist. Here, this prominence at the lower end, this is the styloid process of radius on the lateral side. What is styloid process of the radius? It is nothing but the downward extension from this surface projecting downwards as the styloid process. This styloid process, it having few attachments, important attachment. One of them in the tip, the important ligament is lateral carpal ligament here, and another muscle is attached on this surface close to the tip, that is called brachyradialis, and it is crossed by two important muscles. One is abductor pollicis longus, one is extensor pollicis brevis. Remember that the radial styloid process, it is about 1.25 centimeter below the styloid process of the ulna. So next point is the styloid process of ulna. This is styloid process of radius and styloid process of ulna here. So I have to flex the wrist and forearm is pronated and I will follow the medial border. And here the point below this head of the ulna is the ulnar styloid process. That means in the bone, this is ulnar styloid process, this one. And this process, it is about 1.25 centimeter above the level of radial styloid process on the lateral side. And questions from this styloid process: what are the structures attached at the styloid process? Number 1, the proximal attachment of ulnar collateral ligament, or called medial ligament of the wrist joint from its tip, and the apex of the articular disc is attached at this depression between the styloid process and the lower surface of the head of the ulna. Here is the position, and there is one groove behind this head and styloid process. This groove on the posterior side, on the back side. This groove here transmits the extensor carpi ulnaris muscle. You must remember these 4 bones where you will get the styloid process. Styloid process of radius, styloid process of ulna, styloid process of fibula of the lower limb, and styloid process of temporal bone among the cranial bones. Next important landmark is the pisiform bone. So this is the palm of the hand, and this is medial side, this is lateral side, and this eminence is called hypothenar eminence. This is thenar eminence. So on the hypothenar eminence, towards its base, here medially, I will mark a point here. That point, it corresponds with the pisiform bone. What type of bone it is? It is a sesamoid bone. And what is sesamoid bone? The sesamoid bone having a few characteristics. One of them, number 1, it develops under a tendon. Number 2, it is devoid of Haversian system. Number 3, it is devoid of periosteum, and also it receives its blood supply from the surrounding structures. Then the question is, under which tendon the pisiform bone develops? The pisiform bone develops under the tendon of flexor carpi ulnaris. The pisiform bone appears after birth at the age of about 9 to 12 years, average is 10 years. It is among the all carpal bones, it develops last. The question is, which is the first carpal bone to ossify? The capitate carpal bone, it ossified first, and at the age of about 2 months of age after birth. And largest carpal bone is the capitate, and smallest carpal bone is the pisiform. What are the structures attached to pisiform? Number 1, origin of abductor digiti minimi, insertion of flexor carpi ulnaris, flexor and extensor retinaculum, and pisohamate and pisometacarpal ligaments.